and thank you for audience uh, from India to listen to this topic. It's wonderful to be working with the India Autism Center. So today I will be talking about dealing with stress and anxiety during the pandemic. I'm going to be talking about what the COVID-19 crisis is causing in terms of the psychological impact, as well as what the ways that we can use to cope with the anxiety. And I'll be focusing on both individuals, children with autism as well as adults with autism. I'll be talking more on children first in the first half of the presentation, and then the second half I'll focus on adults. So what is the world doing to respond to COVID-19? So what we see is that everyone is really trying to keep a distance. So the social distancing is causing a lot of different changes in the society that we all have to adopt. And in some places, you have to wear a mask outside your home. Otherwise, some people may give out tickets. So these are some things that on the surface is actually causing trouble, a lot of the physical troubles that we have to deal with. And what I'll be talking about also is the not only the superficial kind of problem, but also other kind of deeper kind of problem that some of us may deal with. And we also want to remind ourselves that despite there are a lot of problems that we are dealing with every day, the medical providers who are in front line are really working very, very hard, and they risk their lives to make sure that most people will benefit from safety. And they also save a lot of lives. And they're also trying to save more lives by making vaccine and also testing medications that may help with treating the patients that contract with COVID-19. So relatively speaking, most of the people are getting a little bit less load than the medical providers, but all of us have quite a bit of burden in this crisis. So I'm going to give a couple of examples that's published recently related to the mental health status of COVID-19. So the first case is coming from the data that the Chinese researchers have obtained. They looked at about 1,800 children who are between second grade to sixth grade. So their average age is just about 11 or so. They are they're from two schools, one in Wuhan and the other in Anxi. They asked the children about, so these are all the children, not only they don't select the children on the autism spectrum, but the second study, they focus on the children with autism spectrum. So this study, when they asked the children about whether or not they worry about being infected with COVID-19, 1/3 is quite worried, about 1/4 is moderately worried, and also just a little bit more than 1/3 say they are only a little bit worried. So the anxiety for the general population, basically, you can see that more than 1/3 of the people are affected. So you would expect that kids on the spectrum most likely are going to be much higher. And I'll show you the data in a little bit. How about asking the question about optimism about coronavirus? It's actually very positive result that 91% of the children are quite optimistic, 7% moderately optimistic, only 2% are not so optimistic. So they know there's the end of the tunnel. They understand that the uh, pandemic is going to go away. And indeed, in this particular case, actually, the uh, uh, the this, the people that were in the two cities that are being studied, they started the lockdown in January. They basically did this study about in February, so they basically were already locked down for a month, and after that, in about a month, more than a month, I think, in the end of March, they opened up. So they they're right to be optimistic. So it's there is the end of the tunnel that's possible. And in terms of the depressive symptoms in these children, these are again typical children for the most part. We don't know the percentage of of kids on the spectrum in this particular cohort, but with 1,800 people, I think we can assume that most are uh, neurotypical children. So in this group, 23% develop depression-like symptoms. So one quarter. And when we talk about depression symptoms, those would be including like low mood, uh, having low energy, low concentration, uh, really not interested in doing things that they usually are interested in, and things like they would not eat as well, and maybe they don't sleep as well. So these about one quarter of the children had those symptoms, and in terms of anxiety symptoms, about 19%. So this is from the Chinese study. The second study is coming from this American study that's that's done really recently. So some of you might know that the United States actually locked down in sometime mid-March. So between mid-March to end of March, basically is the time frame that most states are starting the shelter in place or lockdown. So in this study, they look at they send out their surveys to 70,000 families, and about 8,000 replied. And between March 20th to March 30th, so basically just about a few days to a couple of weeks after the lockdown started, they collected the data. So it's a little bit earlier than the previous Chinese study. That study, as I said, they got the data just about a month after they started locking down. In this study, the participants are both parents, guardians, as well as the children on the autism spectrum. So unlike the Chinese study, this study is really focusing on the population that we are talking about. And on your right-hand side, you can see the entire country is being represented. And when you're looking at the parents, guardians, 93% um, are female who are uh, responding together with the children, and 80% of them were males. And the average age is very similar to the previous study. The previous study is about 11, this one is about 12. So what they are saying is that about two-thirds of the families report severe disruptions in their services and therapies because of the shutdown, and also the social distancing and so forth. And also the family, just about the same amount of impact is going into speech therapy, which is not um, unexpected. Basically, all different services that are typically delivered to children on the spectrum, they are practically affected. And the families were asked to report the settings of services that have been disrupted. Clearly, almost all schools are closed, so it's clear that that's a major disruption. Professional clinic, about one half, and remember this is kind of early in the study, so some of the parents may be only getting the shelter in place for a few days, so they may not have the effect just been felt yet. Uh, and some states were actually not shut down yet at that point. So what you can see is that this data could be an underestimation of the disruption. So about one half of the professional clinics were disrupted, and in terms of the home services administered by the staff, about one quarter, 26%, and about the home services administered by a parent or caregiver, 15%, and then daycare, 7%, residential programs, 6%. Some people are able to utilize remote services. About one-third of them receive such services, probably by Zoom or Skype or any of the video conferencing um, programs. And within that 35% of the families, about 43% of this family said that they benefit moderately to significantly from these services. So clearly, doing services like um, therapy, like counseling or behavioral therapy, is very, very challenging to do that through video conferencing, because it's very difficult to really engage the kid, and it's very difficult to actually monitor exactly what's going on in the environment. So it is not surprising that the satisfaction for the remote surfaces are actually suboptimal. In terms of the mental and emotional health, about 95% of the families feel that the child their child on the spectrum have negative impact, and that's on the child's behavior. And about 82% of the family think that they also have impact on the mental and emotional health. However, interestingly, 62%, lower than these two numbers, of the families report that their child with autism is feeling good overall. So it's not exactly uh, adding up, but what we can say is that perhaps maybe the parents are really thinking that this is actually not as bad as they thought, but uh, is there a negative impact? Yes, there is some negative impact, both on the behavioral side and on the emotional health side. What about the parents and the guardians? So we're talking not only on the kid anymore. And it's not at all surprising that the parents are feeling that these disruptions to the children is causing a lot of stress, and they are quite overwhelmed. And um, that also affects the parents' mental health. About 95% of the parents believe that they are impacted themselves. Um, but overall, if you look at the big picture, one half of the parents are feeling like they're feeling good enough. Definitely, even for those that are impacted, they feel overall it's not so bad. So this is kind of interesting. But what we basically will have to uh, accept is that we have to do things differently. So so in the next few slides, I'll talk about what we can do for children on the autism spectrum during the pandemic. So the first thing before I talk about all of this is that all of these ideas it's not like a recipe. It's not like you have to use every single suggested strategy. Really, whatever, so you know your children best, you probably will have a good idea on whether or not one strategy is more feasible than other. So you should think of it as there are some tools that are suggested, and you probably want to give your best judgment on which one seem to be fitting my child. So the first is it's not only your child; it's also the circumstances, the situation. Everyone's living situation is different, and some people live in city, which can be different from uh, relatively more rural areas in terms of the flexibility and the size of the home and so forth. So all of those have to be taken into account. So the first thing is individuals on the spectrum, whether or not children or adult, structure is really important. When the structure of the day is disrupted, uh, it, there are a lot of consequences. When there is school, when there is no pandemic, there is a lot that they are used to, and there is a lot that they enjoy doing at school. So now, with the pandemic, every day is a little bit like yesterday. Every day is almost the same. Um, so it's going to be important to figure out what structure can be set, and those would be potentially new routines that you have to uh, agree with within your family. And whenever there is a consistency in um, having the timetable to be followed, if everyone is following, everything is going to be a little bit easier. But it is easy to say, it is not easy to do, but it is really important. Having a structure that's going to be sustainable in the next few months, potentially, because we may be having no school until the fall. So for most countries, that's kind of the expectation. So we'll have to figure out how to make the weekdays somewhat different from Saturday and Sunday. You want to make sure that the sleep cycle is not changed dramatically, as much as there's no uh, hurry in the morning to get the children to school. Um, if your children are waking up like 12 o'clock at noon and going to bed at midnight or something like that, in a couple of months, it is going to be very, very difficult to change the structure. And in the fall, when school is starting, it's going to be, again, very difficult battle to fight at that time. And it's not good even for the time being. So what I really urge you to think about is uh, figure out the new routines, a new structure, and try to have all the family members stick with it as much as possible. Another strategy that a lot of people use for individuals on the spectrum are social stories. There are a lot of different things that are going on, like the infection itself, why we are not uh, going to um, the department store, we're not going to the grocery as a family, all that. If the child is being confused, it it may be easiest to just make the social story and try to explain to the child, and this way they understand and they can internalize uh, the change, which will make things uh, more comfortable for them. If they feel everything is changed and there's no reason, there's no explanation, they can get very upset, they can get very confused, and uh, if you are dealing with this for one thing, it may be not a lot, but if you are dealing with many changes, having a social story that can pull things together to make sense out of the current situation is very helpful. Also, there is time now to pursue some new things. So it's also time to get to know your children. Sometimes when we are so busy, we are we're not really spending enough time with our children, and maybe we're not really doing the things that they're interested in with them as much. So pursuing hobbies with them together, this will be good for bonding between parents and children, and this will be a time to uh, make this pandemic situation a little bit easier. Maybe there are some things that can be fun to do, and that would be nice. Also, as much as there is a structure that we are recommending for you to consider, like having a timetable for your children, it's also important to put in breaks for rest and relaxation. This way, everyone is a little bit at ease, and you don't really feel like you have to be like handling everything all the time. So when your kid is resting, relaxing, you can do whatever you want, or you can relax yourself as well. And also having your children to be helping out in a meal is a good thing to bond. It's a good thing also to teach them something that's helpful. Um, so as they grow up, they need to learn independent living skills. So this is a good time to to teach them some uh, things that can be useful for every day. And if they used to rely on everything to be done for them to before they come to the to the dining table, maybe it's time for them to get involved in even preparation, maybe washing some lettuce, or if the child is old enough, can also cut some vegetables or something. So all these things can get the children to feel that they are useful, and they feel like they gain skills, and that's a very beautiful thing, and you are doing it as a family. And at the end, if you all contribute and you have a good meal, everyone is happy, they feel very satisfied as well. So having your children to be involved uh, in preparation of meals is a potential thing for some children. Definitely not for all children. Some children, it may be a little bit of a hazard for them to be in the kitchen. But if you exercise your judgment and you know my child is ready for this, so you can bring your child to the kitchen. Also, enjoy time with your family. So your immediate family that live with you, clearly, they can enjoy time with you. Um, you can watch movie with them together, play board games with them as well, or other things. But also, this is the time to do family reunion virtually. Um, I have to say, uh, I have not been doing as many family reunions until the pandemic. We usually have like family reunion once or twice a year. Now we are doing it every week, which is a very good thing. It's a very beautiful thing to get connected with other family members. So the grandpas, grandmas, and the cousins and uh, aunties, uncles, they can all be connected. And so the social distancing that we talk about is not going to be really literally distancing socially. So it's different. It is different. We don't want to distance ourselves socially. We just want to socialize in a different way. And some kids do have enough anxiety that it's going to be causing enough problem, and sometimes they do have enough depression um, that may need medical attention. Now, because of the telehealth possibility, a lot of places uh, in many countries are using telehealth appointments. It is not perfect, but uh, definitely, if someone is not doing well mentally, it's not actually ineffective at all. In many ways, what we are seeing now is that the behavioral treatment is kind of different. If we are talking about cognitive behavioral therapy, that's actually done without much um, change in terms of the quality. And a lot of people are showing good data on that. So do not really dismiss the telehealth option. It is definitely much better than having no treatment. And in fact, this may be actually quite effective. One other thing that I want to mention is that while your children are out of school, some schools are still having some teachers do certain kind of sessions, would still send homework to children. Definitely get connected with the teacher and figure out what exactly is going on. And in the United States, the children with autism in school, they and also other developmental conditions, they have something called individualized educational plan, and every year there would be meetings needed to make sure that all the plans are in place and so forth. And also, the teachers a lot of the time know your child very well, and sometimes they can also problem solve with you. Some parents are very much able to handle the current situation, doing everything full time, but not every parent will be able to do to deliver ABA, applied behavior analysis, will not be able to play with their child all the time. And if their child is very active, some parents cannot keep up. So it is it is definitely not an expectation that the previous situation when there's school, uh, the teacher can handle it, and now the child is at home. Now I have to handle everything. That's not the expectation. The expectation that is that you do your best. If you do your best, that's going to be good enough. You know that there are some children that would need more therapy, and it's possible that they may have the same progress. Maybe you are still making them to have advances in different ways. But some children, without the treatment, without the behavioral uh, therapies, sometimes they do regress a little bit. So what you want to do is to make sure that you capture what's going on in the coming months so that you benchmark where things are. And if you are seeing that there is a regression, then you may want to get some ideas from the teachers and see if they or the ABA therapists and see if there's anything that you should do while they cannot deliver the treatment at your home. So, after the pandemic is over, you can show the teachers also the videos and tell them this is where the child is at the moment. You maybe we should adjust the plan. Otherwise, the teachers may not remember whatever the educational plan that was written before might be correct and appropriate a few months ago. A few months later, because of the changes, if there is regression, you may need to adjust the plan. So the next half, I'm going to talk about adults on the autism spectrum. So the first thing is social isolation. We know this is a given. However, there's a range. For some people that are relatively higher functioning on the spectrum, they live independently. They live. They could live at home, and there's no problem. There are some adults who are, and also could be happening in children as well, that they live in residential homes. And because of the pandemic, because of the shutdown, lockdown, they are all visits are stopped, and they are the parents who used to be providing comfort and providing the social stimulation is absent during this time. So it is important for us to know that there are people that have really dramatically lower social interactions, much more so than most others that are affected. The second stressor that we need to understand. The reason why we want to talk about all these stresses is that we want to make it like really matter of fact. We know what's going on. We don't want to ignore that this is not a possible thing to cause stressor. And by knowing what's going on, we are going to be able to figure out what may be helpful strategies to reduce anxiety. So the second thing is about duration of shelter in place or lockdown. So because the at least in the United States, uh, whatever the local government, sometimes they say different from the state and different from the federal government, and the change in the duration of the shelter in place is very frustrating. That really leads into the sense of helplessness because you're losing control. Uh, it's possible that like 2 days ago they say the shelter in place is going to end in 2 weeks, and after a few days they say there's actually shelter in place for another 4 weeks. So all of this moving targets can be quite frustrating and can be anxiety provoking. So this is all about the uncertainties that people feel lost, feel confused, feel really disoriented, and especially when every day is just about the same. And that talks about that's also calling for the structure that's needed to really reduce the disorientation. And there's this fear of infection as well. We really don't know how this is going to affect each and every person, how that fear is going to be. But definitely, for some people, it is more difficult, and especially for those that have fear of fear of uh, infection or contamination, uh, even before the pandemic. Those people are really suffering a lot. So it doesn't uh, take much for us to understand that the shelter in place causes a lot of boredom and frustration, and all of this is really causing us to feel quite irritable and sometimes numb. And by knowing that you are actually in that place and you want to actually make change is helpful. So basically, it's it's understandable that most people would be feeling that way. And for some families, it is not just about the psychological. The physical, like the adequate, the food and supplies in their household, sometimes they don't have enough. So there is going to be additional layer of stressor in those families. And then uh, we got fake news. We got a lot of things that are inaccurate in our lives. And when some of the leaders are talking about something that doesn't make any sense, that really make us feel inadequate as well. So basically, all of these we will have to take into account how much we can take in, and how much we sort out. And a lot of people now with shelter in place are doing what this uh, lady is doing, working at home with kids surrounding her. So this really reduced the level of concentration for this lady, and it can really cause the job performance to go down and could affect employment as well. So, like, this is what I'm getting at, the job instability. And indeed, because of the shutdown, there are people that are losing jobs. And that affects people with with their finances, and for people like me who's Chinese. So sometimes we hear things that we really don't want to hear, because uh, of really misunderstanding, misinformation. So all of this we have to deal with. So the next few slides, I'm going to talk about what we can do. But the most important thing to think about what to do is to really acknowledge that you have to know yourself. And if you learn different ways to manage your anxiety and stress, and think about what actually works for you, that's basically what you need to do. Different people have different triggers, different people have different strengths, different skills. So you have to assess your strengths, your skills, and your triggers. Again, like the children, structure, new routines. Don't need to talk too much about this. And then rest and relaxation, same. And the other thing is self-care. If you can eat well, if you sleep well, have a good sleep routine, you don't have disrupted sleep, you have good physical activity, all of that will prepare you to solve problems, because we are dealing with a lot of uncertainties. And with uncertainties, you need a lot of uh, good confidence. You need to have confidence in yourself, and you need to know how to solve problems when the problems are going your way. So if you are not doing self-care, you're not going to be in good enough of a place to be the best of yourself to solve problems. So prepared to solve problems with a very clear mind. So what I would say is that if you meditate, you should try to do that. If you do mindfulness training, try to do as much as possible. And when there are problems coming your way, whether or not it's related to your family or your employment or finances or whatever, you need to really understand the problem. You need to figure out what you can do for your family or for your employer and so forth. So you need to have a very clear mind. If your mind is kind of numb and tired, you won't be able to make the best decisions. So it's important to take care of yourself. And you want to ask questions like, what choices do I have to make do I have right now for every single problem? And you want to ask questions like, what decisions have I already made, and what is the first step that I need to do? What may be things that I need to monitor to solve these problems? And what do I need to create in order to solve these problems? So if you methodologically think about the steps, and you know this is what you need to do, and if you have a clear mind, then you're going to be able to solve the problem the best you can. We are all humans, so we won't be able to do everything perfectly. And in this pandemic crisis, there is no perfection. No one is going to be perfect. So don't expect that you are going to be perfect. And no one should expect you to be perfect either. So accept this imperfection of yourself. Also accept the imperfection of others. This applies to everyone. So when we are not as rigid, one thing about people on the spectrum is that there's a lot of concreteness. There's a lot of black and white. There's a lot of striving for perfection. And in this day and time, there's no perfection possible. So if they accept that it is okay, it is okay because this perfection really does not exist now. It is going to be so much easier on them, on them. And again, telehealth appointments, if there are any uh, bigger problems, mood problems, anxiety problems that are just like too heavy, uh, it's fine to do a telehealth appointment with your mental health provider. You may be able to get quite a bit of benefit from it. So um, this is the summary slide. Basically, we have talked about is very important to have structure. It's important to find some new hobbies. It's important to get connected to the people around you. Maybe cooking with them, play with them, and have connections through video conferencing with your family and friends. Treat yourself well. Make sure that you eat well. Make sure you exercise. Make sure you have a clear mind, because there are going to be some decisions that you need to make so that you and your family will get through this pandemic together. We will get through this. So with that, I'd like to thank all of your attention, and I'll be happy to answer any questions you have.
Thank you so much, Professor Fung. After your presentation, I'm feeling quite at peace with this whole situation. I do have a few questions for you. I mean, the participants do. A few are about telehealth. I have Ayushi Srinivasan asked, Hi, Dr. Fung. I'm a psychologist and I conduct my sessions through video calls during the pandemic. What I find challenging is to connect with non-verbal children with autism who find it
Mm.
extremely difficult to communicate with us and their parents. What would you suggest to not cause a regression while they're at home?
Yeah, with the difference in the setting, it is difficult to engage with anyone. It's more difficult than before. But for kids that move around a lot, the kids that are nonverbal, it will be harder. So what I would say is that there are some uh, kind of basic steps that we may want to consider to basically ahead of time make sure that the family members are getting the child ready, making sure that the child knows that there is going to be a appointment with the psychologist, and kind of get the child ready, and make sure that the child is going to be in a selected location in the house that's conducive of interaction with you. If the child can move around a lot, I have patients that I feel very challenging to engage with because they just move around so much, and the parents move with them. I, and what I have to do is to basically remind them, and sometimes I need to set limits and tell them what needs to be done. So, so if you do those basic things, it's possible that it's a little bit easier to engage with the nonverbal child, but it's not exactly the same. It is kind of the more difficult situation that you're dealing with, because you cannot do the same communication anymore when you are in the same room as the child. So all the other inputs that you were delivering before, or when you're in the same room, is not there anymore, no matter what you do. So definitely, there's no complete answer for this. You can basically just enhance the environment making sure that there is a higher chance for you to engage with the child.
Great. Thank you so much, Professor Fung, for answering Ayushi's question. The next question I have is from Vinita. She asks, any websites you can recommend for social stories specific to the pandemic situation, like regarding wearing a mask or practicing hand washing, etc.?
Yeah, I do have some websites that I can share with Saki. So after this, I will find those websites or PDF, and then I guess
I'll
the
just,
audience can, yeah,
yeah,
you can distribute some in some way.
I'll do that. The last question is by Sudarshana. She says, do you have any strategies for children who are aggressive when they don't get attention? How do you encourage children to stay on task when you're not watching them?
I don't quite hear the first part. Can you repeat?
Any strategies for children who are aggressive when they don't get attention?
Uh-huh.
How do you encourage children to stay on task when you're not watching them?
So the child is aggressive and want to seek attention, and and you want to make you want to do something that maybe when you're not watching them, they are still okay. So basically, this goes back to the typical kind of behavioral approach that you need to really understand the situation. So it seems like the uh, the aggressive behavior, the parent already know that this is to seek attention. So the other thing is, what is the consequence? So if uh, the the entire behavior is a little bit more understood, there could be some strategies that can be done to improve the behavior. So definitely the bad behavior should not be rewarded. Good behavior should be rewarded. So basically it is really trying to tune that in order to allow this to happen.
Right. Get it. I just have one last question. So the pandemic wasn't exactly a gradual change that we could have prepared for, but just if you had to give us 2 or 3 points as to if we have to restore our normal world now, what are the 2 or 3 takeaways um, that we can use to help people with autism?
Mhm. So is it 2 to 3 additional points, or the same the main points that
Main,
the main points?
the main
The,
point.
yeah, I would say the really the most important thing is the need for the structure. That's the number one, and the structure has to be uh, as close to the regular time as possible. Um, and the second point is uh, you really need to get everyone to be accepting that it is okay not to be doing everything just like before, because we have different resources now, and we are not able to achieve the same thing. So if you're allowing yourself to make sure that you are doing your best, you don't really have to achieve everything that it used to be. Like, even if there is a little bit of regression, there are some children that unfortunately they will be. having some regression just because they ordinarily would need a lot of support. And right now, the support is not there, or the support is much lower. So, and then the third thing is that um, I would say is it's important for all of us to really make sure that you are as healthy as possible. So without health, really, you cannot do a lot of things, and that also affects a lot of people. So when there is recommendations for the social distancing and all the different things that are necessary, it's really important to comply, and it's okay to be going back to the workplace a little bit later, because this may be the answer before we actually have a vaccine that can protect us.
Thank you so much, Professor Fung, for taking out the time to do this webinar here for us. Thank you.
Thank you so much, Saki and everyone.
Thank you. So
Take care.
yeah, so just to the participants, I'm here for the next 5 minutes or so. In case you have any queries about India Autism Center, you can leave them in the chat box and I'll answer them for you.
So I'll sign off for now, and I'll send you the website.
Yes.
All right. Okay. Take care.
Thank you. To get the video recording, the easy